with us this evening. Katie is a certified nurse midwife, and she's the executive director of the Alliance of Nurses for Healthy Environments. Ms. Huffling is working with the nurses and national nursing organizations on a variety of environmental health issues, including climate change, chemical policy, inclusion of the environmental health into nursing education, and sustainable healthcare. She has written numerous peer-reviewed articles on environmental health issues and is the editor of the recently released environmental health e-textbooks, Environmental Health in Nursing, which won the 2017 AJN Book of the Year of Environmental Nursing. And she's currently a member of the US EPA Children's Health Protection Advisory Board. So she has a very robust and exciting background and resume. And we're very excited to have her join us here this evening to share her expertise with us. So thank you so much for joining us this evening.
Alrighty. So just to tell you a little bit about my organization, the Alliance of Nurses for Healthy Environments, we work with nurses and nursing organizations around the country on a variety of environmental health issues. And over the past several years, one of the I think biggest issues that we've been working on is around climate change. And I think there's so many opportunities for nurse leadership around climate change, especially in the policy realm. We definitely need more nurses talking with policymakers and helping to draft policies. I think there's just from beginners to really experienced policy nurses, there's so many opportunities around climate change where we can have such an amazing positive impact on the health of our patients. So just to kind of set the stage, this quote here is from the 2019 Lancet Countdown report on climate change. And when they chose to lead with this statement, I had never seen them use such a strong statement before. They've been doing these countdowns yearly for the past few years. And as soon as I saw this statement, I was like, wow, this is such a strong call to action from, a kind of staid, health journal. I think it really shows the urgency of the issue. And I would just highlight, without accelerated intervention, this new era will come to define the health of all people at every stage of their lives. Climate change is one of the biggest public health threats that we face today. I always used to say it was the biggest public health threat, but with COVID, it's, taken the second stage to that. But besides being one of the biggest public health threats that we face, it's also one of the biggest opportunities. When we address climate change, we can have an amazing positive impact on health globally and the health of future generations. And now more than ever with COVID, nurses are in the public eye and we're being recognized for our leadership, compassion, and excellence in supporting health. And so we're perfectly poised to lead the charge in addressing climate change. As the largest portion of the healthcare workforce and the most trusted profession, our voices and actions matter. And as we all know, nurses are solutions people and we know how to get things done. And so we know that our planetary vital signs are showing a planet in distress. We're faced not only with climate change, but also with declining biodiversity, loss of tropical rainforests, lack of fresh water, and increasing frequency of natural disasters like wildfires and hurricanes. Changes to our natural life support systems are already impacting our health and the health of those we serve. These ecosystem transformations are projected to drive the majority of the global burden of disease over the coming century, impacting the vulnerable and future generations the hardest. As nurses, with our holistic approach to health, we recognize that everything is connected. The health of the planet directly impacts the health of people. And we now know that we have no time to waste. Climate scientists have been saying that in order to mitigate the worst effects of climate change, we need to keep the average global temperature increase below 2 degrees centigrade. However, in an extensive review of climate change research released in 2019 by the United Nations Intergovernmental Panel on Climate Change, they found that there's significant differences in environmental impacts and resultant health impacts if we're able to keep that average temperature change below 1.5 degrees Celsius, and that we need to accomplish this by 2030. For example, if we're able to keep the temperature change below 1.5 degrees Celsius, half the number of people globally will experience water scarcity. And instead of 37% of the world's population being regularly exposed to severe heat waves, we'll be able to cut that by more than half to 14%. And with COVID-19, we're seeing this multi-system failure play out in an unprecedented fashion. We do not currently have evidence that climate change has an impact on the spread of COVID-19. However, climate change is in part responsible for the factors that make the likelihood of a pandemic increase. As the global temperature increases, where animals live and thrive is changing. With these changing habitats, animals are now coming into contact with humans in ways they haven't before, creating an opportunity for pathogens to get into new hosts. Also, you may have seen research that came out of the Harvard Chan School of Public Health, where researchers found that people who live in areas with poor air quality were more likely to die of COVID-19, even when taking into account other risk factors such as pre-existing medical conditions, socioeconomic status, and access to health care. It's imperative that we address these environmental exposures as we're addressing COVID-19, or we'll continue to see those bearing the brunt of environmental contamination to continue to fare the worst in this global pandemic. As you can see on this slide here, the US is one of the biggest contributors to climate change. If we're able to make changes here and support other countries to move away from fossil fuels and other practices related to climate change, we can have a significant positive impact worldwide. As you can see also on the right, the two biggest contributors to greenhouse gas emissions are transportation and electricity generation. Healthcare in the US is the second largest user of electricity, with almost 10% of all electricity generated in the US used by healthcare. So when healthcare takes a lead, we can again multiply these positive impacts around climate change. And just as we see with other environmental health issues, climate change doesn't impact everyone equally. Pregnant women, infants, children, and the elderly can all have more severe health effects from climate change due to their developmental stages and age-related physiology. As pediatric nurse practitioners, you have an incredible opportunity to prevent disease and to help your patients on the path for a healthier future by addressing climate change. And you can see listed here some of the differences that put them at increased risk from a variety of different health issues. And the time is now. Well, we all knew that 2020 would be a big year for nurses, with the 200th anniversary of Florence Nightingale's birth and 2020 being designated as the year of the nurse and midwife. None of us could have been prepared for how the public esteem of nurses has exponentially increased as we're being recognized for our vital work. So now we need to harness this energy and public consciousness and have nurses working to support climate solutions. So what can we do? Nurses have always known that the best way to prevent needless suffering and death is through strong and effective public and population health. We therefore plan to do all we can to minimize the chance of future pandemics. That means we need to protect the health of the planet in order to protect the health of humanity. Even in the midst of a global pandemic, nurses are dedicated to building a healthier future. The science is clear. The climate crisis poses one of the greatest risks to health that humanity has ever faced, and the time to act is now. But fortunately, the science is also clear that there's actions that we can all take to effectively draw down the level of greenhouse gases in our atmosphere. And first, I wanted to start with a project that my organization just launched. That's a way, I think, to get nurses that maybe don't know a lot about climate change, or maybe are unsure what to do, to help give them a first little entree in climate action. So this project is called Nurses Drawdown, and Nurses Drawdown is based on the science of Project Drawdown. Founded in 2014, Project Drawdown is a nonprofit organization that seeks to help the world reach drawdown, which is the future point in time when levels of greenhouse gases in the atmosphere stop climbing and start to steadily decline. They're a leading resource for information and insight about evidence-based climate solutions. So Nurses Drawdown is a project of the Alliance of Nurses for Healthy Environments and Project Drawdown. We had an all-volunteer planning committee made up of an international group of nurse scientists, leaders, and advocates on climate change. And they were so amazing. They put in so much time and energy into this project and developing all of the resources that are, available on the website. And this planning committee decided to focus on 5 key areas for action that have clear links to health. And all of these are based on the evidence collated and pulled together by Project Drawdown. And so the different areas are food, which is commit to a plant-based diet, use of clean cook stoves and reduced food waste. Mobility, which is supporting bike infrastructure, walkable cities, and mass transit. Gender equity, which is educating girls and increasing access to family planning. Energy, which is supporting a clean energy future by promoting energy efficiency and advocating for a transition to renewable energy. And then finally, nature-based solutions, planting trees and protecting forests. When we launched this summer, we created this video that you can find at this link, which talks more in depth about the project and why nurses around the world are engaging in Nurses Drawdown. So if you're interested, please share. We'd love to have any of you here on the call join us. And we're also looking for videos, like really short selfie videos of nurses talking about why they're taking climate action or what things they've committed to do. So if any of you are interested, you can sign up on the Nurses Drawdown website. We'd love to hear from some pediatric nurse practitioners. I think your voices would be really compelling and would be a great addition. Next, I wanted to tell you about a couple of things that are going on federally in the policy realm. The first is from the House Select Committee on the Climate Crisis. This committee was authorized by House Resolution 6 on January 9th, 2019. They were originally going to publish a set of policy recommendations outlining how all government agencies should be addressing climate change in March of 2020. This was obviously delayed due to the ongoing pandemic, and they finally released it the middle of this summer. It's entitled Solving the Climate Crisis, the Congressional Action Plan for a Clean Energy Economy and a Healthy, Resilient, and Just America. And it calls on Congress to build a clean energy economy that values workers, centers environmental justice, and is prepared to meet the challenges of the climate crisis. It's around 500 pages long, so it's not a quick read, but they did do something that was really smart and is great for folks working in the policy areas, is that they have one-page fact sheets on a variety of different issues that they talk about in the report and why they're important for policymakers to be addressing them, and then what's the different policy pieces that they should be addressing in order to help to minimize those climate impacts. And so the one I pictured here is on public health and what Congress should be doing to address the health impacts of climate change. Unfortunately, we felt like it really didn't highlight the compelling pieces of why it's so important to address the health impacts of climate change. There's a lot of research, like public polling, that really shows that one of the most important pieces in getting folks to address climate change or want to act on climate change is making that health link. So we felt there was an opportunity to make that connection stronger. And so We have just released this new 8-page report that can be utilized by nurses, other health professionals, and the public. We wanted that to be used to help them talk to their elected officials as well, right now in the election season, talking with folks running for office about why it's so important to be addressing climate change. And on the front cover, we purposely highlighted a variety of positive health impacts that could be realized if we take strong action now to address climate change, such as healthier lungs in children, healthier pregnancies, fewer asthma attacks, and fewer incidences of autism and ADHD. And then on the inside of the report, it goes into greater detail about the science and climate change impacts. We also have an extended bibliography available on our website at environ.org, Common Solutions. We created the shorter report without this extended bibliography because we wanted something that was kind of punchy and really highlighted more of the vital information as opposed to having many pages of bibliography. So if folks want more information on the evidence that we used, it's available online. We also have, we are currently organizing visits with elected officials at the federal level and encouraging nurses to also make appointments or try to make appointments with folks running for office as well. I've got hard copies of this that we're happy to send you, or if you need help making appointments, if you wanted to talk to your elected officials, the link here, the Google form, you can fill that out if you'd like any help from us. And I know NAPNAP has tons of help that they can give you there as well. But we've got lots of resources I can send you to that on using this report to talk to your policymakers. And we would love feedback on it too. Because we, if it is something that's successful, then we'd want to do others on different issues. And then, not to be outdone by the House, a little over a month ago, the Senate Democrats' Special Committee on the Climate Crisis released a new framework to address climate change entitled The Case for Climate Action, Building a Clean Energy Economy for the American People. And this report includes 15 pillars that outline policy recommendations and a framework for Congress to address the climate crisis by focusing on reducing emissions that worsen climate change while concurrently advancing economic and environmental justice. This report is a more manageable 250 pages, so still a pretty heavy tome, but they do have a really robust section outlining the health effects of climate change and how federal policies can improve health. So I would highly recommend taking a look at that. They've got some really great talking points and some really nice recommendations there. Right now with our federal policymakers, especially right now before the election, nothing's really moving outside of things around the Supreme Court, folks campaigning, but we can start thinking about priming for after the election. Like, what are we going to be wanting to talk to our elected officials about? And I wanted to leave you with a couple things that we can do now that I think could be really positive and a great way to emphasize the nursing perspective and something we can do while we're waiting for the election to happen. The first is this new report that's coming out, running out of time. It's going to be released on October 14th. And they're calling on major life and health insurers to divest from fossil fuel companies as these investments contradict the insurance company's mission to protect human health and support well-being. So they're currently looking for organizational signatories, and they're also doing a letter that will be going to, I believe, the top 10 insurers in the US, calling on them to be divested, and they're looking for organizational sign-ons for that as well. And then there's this letter that's being organized from nurses, physicians, students, it's addressed like to the American people, talking about climate change and why our elected officials need to be actively addressing it. This letter has been reviewed by folks to make sure that it's nonpartisan. It's okay for organizations like such as mine, that is a 501c3 organization that can't participate in partisan politics. It's been vetted to make sure that we're completely safe around the election. And we're hoping to get 11,000 health professionals signed on by mid-October. They're at close to 4,000 now. So, you know, we would love to have any of you sign on and let your colleagues know about this sign-on letter as well. And we're hoping that, you know, with getting a large number of health professionals signed on to this letter, that we'll be able to get some really good media response from that. So those are a couple of, I think, kind of nice things that we can be working on, highlighting the work of nurses and why we think it's important to be addressing climate change in the short term while we're waiting for the election to happen. And with that, thank you so much. And I'd love to have a discussion about what you think about work that you're doing around climate change and how we might be able to work together. So thank you.
Thank you so much, Katie, for the wonderful presentation. It was so insightful, and you know, I think it definitely gives us some more opportunities to think of ways that we can actively, as an organization and as individuals, be involved. So if anyone has some questions that you'd want to ask, you could either place them in the chat or unmute your mic and go free to go ahead and ask.
Katie, hi, this is Karen Duderstadt.
Hey, Karen.
Good to see you. And I am really glad that you brought up the information about both the House and the Senate working on climate, because that really unfortunately hasn't gotten any press, and that's even if someone's been following this, I really hadn't heard about that. So we're hopeful, yes, that after the election that these documents would be rolled out and get some play. So I'll definitely take a look at those. The other piece I wanted to bring up is that the Climate Health Now, which is an organization of physicians and nurses, which you know about, Katie, is also working on the health insurance, divestment of health insurance from fossil fuels. And it is a campaign that they want to get the signatures by mid-October. So I do have a request out to other key on the board to look at a NAPNAP sign on for this. I don't know if that will happen, but I am also in the process of posting on Team Peds, which is our chat within the organization, of an opportunity that actually has the same link. So if anybody didn't get it from the slides, that should be up later this evening, so that they can participate as an individual and sign on to this effort. So thanks very much for your work and for bringing that up to this group.
Yeah, and you know, these divestment campaigns can be incredibly effective. You know, it just showing that organizations can still make a profit in their investments and not be supporting an industry that has such a huge negative impact on health.
And just to say that they're focusing on 10 of the largest insurance companies nationally. And I hadn't looked at this particular issue until more recently. And at the top of the list was my insurance company, which was always just discouraging. And for those of you who might be Kaiser nationally, this is a little bit larger organization in the West, but Kaiser was one of the lowest investment in fossil fuels. So I'll try to attach that list to the Team P so people can look at that. So you never know how you're involved in this in subtle ways.
Anyone else with questions? Things they want to discuss? I was going to ask you, as part of, you know, we're looking as an organization to also have a statement that would be specific for NAPNAP, as you know, there's obviously the medical associations have their statements and such, and we're, you know, thinking what makes us unique as a pediatric nurse practitioner organization that, sets us as apart, or what can we specifically focus on, not only as nurses, but as advanced practice nurses. So maybe if you have any insight of those kinds of things that you think that, an advanced practice pediatric nurse could bring to the table.
Oh, definitely. I mean, you're with families, from the beginning through past adolescence, and children are particularly vulnerable to many of the health impacts of climate change. And you're with those families, and, in your work with those families, we all try to prevent disease. We would much prefer to prevent than have to treat. And so I think highlighting the opportunity to prevent so many significant illnesses that are linked to climate change, whether it's increased asthma rates. There's some research that shows that some of the air pollutants linked to climate change increase the risk of neurodevelopmental issues, such as ADHD and autism, learning disabilities. I think there's just so many points that you can raise around the special vulnerability of children, and how, unless we address climate change, it makes you so much harder for you to do your job to take care of those kids.
Thank you. If you were having a conversation also, with people who may not be so enthusiastic, or, feel that there may be competing priorities, like, how do you kind of start that conversation, or maybe engage them in that, and kind of, have people hear the rest of the story?
Sure. I think, trying to find that personal health connection. I think, looking at the different health impacts of climate change, we're already feeling them here in the US. And so I think one is making that personal connection. But then the second thing is that, we can all, even if it's a small piece or something big, we can all make a difference working together. And, I like to say there's over 4 million nurses here in the US. And if even a fraction of us are taking the lead, we can actually make really big change. And, definitely overall, we need policy change at the federal level and the global level to, completely address climate change. But there's so many things that we can do at home or in the workplace, even just little things to kind of get started, can make a really big impact.
Thank you. Is there anything else anyone has, or anyone else have a comment, question, anything like that? Okay. Well, if you don't, we, as always, will have recorded this presentation, so others who may not have been able to participate tonight will have an opportunity to listen as well. And you can always contact us as well at healthpolicy@napnac.org, and you can ask your questions, and we can certainly make sure that gets to Katie if there's anything that you wanted to ask after the presentation. So thank you again for taking the time to spend with us this evening.
Thanks so much for having me.
Yeah, and we were very excited for you to also share an hour worth of your presentation with our California chapters for our virtual conference this fall. So thank you.
Thanks so much. Have a great evening, everyone.
You too.
Okay, take care.
So with that, we're moving on to Dave Mason's updates for the evening. So thank you, Dave.
Thanks, Sarah. And it was great to have that discussion with Katie about the environmental issues. I unfortunately won't be covering a lot on that. The November 3rd election is now 27 days away. The president's back at the White House after having been hospitalized with the coronavirus, and he has ended negotiations on the pandemic relief package, sort of. Congress is back home on the campaign trail, except for the senators, as Katie said, who are up here working on the Supreme Court nomination. And the best news out of all of that may be that the federal government is funded through December 11th, what happens then relies a great deal on what happens on November 3rd and who wins the election. So let me go into some detail about those things. As you know from all the news coverage, after a 3-day stay at the Walter Reed National Military Medical Center, President Trump triumphantly returned to the White House on Monday after being diagnosed with COVID-19 last Friday. He pointed out, or rather he pointed to his own experience as a way to implore Americans not to fear the virus, and to, and in the show of returning at the White House, kind of defiantly removed his mask as he entered the residence. Hours after that, he stunned pretty much everyone involved on both sides of the issue and both sides of the aisle by telling Republicans to cut off their negotiations with Democrats on Capitol Hill on a 5th coronavirus relief package. That was just a day after the chairman of the Federal Reserve called on Congress to approve additional aid to avoid damaging the economic recovery. However, in a tirade of tweets last night after calling off the negotiations, the president then called on Congress to send him separate bills that would provide $25 billion to help the airlines and another $135 billion for small businesses. So he may not be quite done negotiating yet. And I think it still remains to be seen this week and perhaps next week whether those negotiations gain a little bit more steam. Earlier today, the White House Chief of Staff, Mark Meadows, said that he and the Treasury Secretary Steve Mnuchin were actively considering standalone bills that would distribute checks to Americans while providing aid to the airlines and small businesses. The difficulty there is that congressional Democrats have kind of steadfastly and repeatedly rejected the idea of doing standalone fixes. They want to do a package that covers a whole lot of priorities and actually will appeal, hopefully, to both sides of the aisle. So it remains to be seen where all of that goes. To take a quick look back at where we were just last week, a week ago, the House narrowly passed a scaled-down version of the HEROES Act legislation that it had previously approved in May. $2.2 trillion bill that the House passed was $1.2 trillion less than that earlier bill, but it still included $436 billion in emergency aid for state and local governments, $225 billion for schools and childcare, an additional round of $1,200 stimulus checks for most Americans, and money to restore $600 a week expanded unemployment payments through January. The bill, as far as nursing goes, the bill also included funding for the National Health Service Corps and the Nurse Corps, as well as the aid to small businesses and to nonprofit associations. So the good news was it passed the House. The bad news was the Senate's not interested. And we find ourselves in the negotiations or lack of negotiations that we're in right now. It is very, very possible that there will be no additional relief coming before the election. We may have to wait until the lame duck post-election session. And even then, depending upon the outcome of the voting, we may be looking at early next year before there's additional legislation here. So certainly something we're going to be keeping an eye on in the coming weeks. Before we leave coronavirus, I'm sure you have also seen the recent news headlines. It's hard to keep up with all of the developments from day to day. But as you probably know from the news, National Institutes of Allergy and Infectious Disease Director Anthony Fauci warned yesterday that between 300,000 and 400,000 people in the country could die from the disease if we don't do, quoting him, if we don't do what we need to in the fall and winter. He also added that a vaccine likely will not be available, or at least widely available, until next summer or fall. So kind of a wake-up call, if you will, for the current situation. The Food and Drug Administration yesterday also issued strict new guidelines for the coronavirus vaccine developers who are seeking emergency authorization. Those guidances include requiring at least 2 months of safety data. Even though the president then immediately called the guideline a political hit job that would make it more difficult to speed up vaccine approvals before Election Day. The White House tried to block the release of the guidance, but ultimately relented. And then just this afternoon, in case you haven't seen the latest, the president declared that an experimental antibody treatment that he was given last week at Walter Reed is indeed a cure for the virus, and promised that it and similar medicines would soon be available for free for all Americans, although the treatment hasn't yet been approved. He suggested that his infection was indeed a blessing from God that revealed the drug's effect, and he also said his administration would authorize emergency use of both Regeneron's treatment, which he received, and a similar antibody drug from Eli Lilly. Both of those companies are in talks with the Food and Drug Administration, but are not yet approved. The companies say that their antibodies will help COVID-19 patients clear the virus from their bodies, and it appears, at least in some cases, to speed recovery, but it's not clear if the drugs will reduce the risk of death. And of course, the president's experience also included him receiving several other medications, including a steroid and the antiviral drug remdesivir. So still a whole lot of moving parts when it comes to trying to get an safe and effective treatment for the virus going through the process. That's kind of, and you probably will keep up with the headlines as well as I do as this story develops on the coronavirus and efforts to combat the pandemic. As Katie mentioned, the other issue that is currently on the federal horizon in cutting off the negotiations on the coronavirus relief deal, the president told Majority Leader Mitch McConnell to have the Senate focus full time on confirming Supreme Court nominee Judge Amy Coney Barrett before Election Day. And McConnell does intend to do that, although his plans have been somewhat shaken up by 2 members of the Senate Judiciary Committee also having tested positive for the virus, and several other members known to have had direct exposure. So not real clear how the schedule is going to play out. But at this point, the Judiciary Committee is still planning to open confirmation hearings on Judge Barrett next Monday. A committee vote on sending her nomination to the full Senate could be taking place by October 22nd, and that could set up a final confirmation vote about a week before the election if McConnell's schedule continues to hold firm. Healthcare issues are obviously going to be a big part of the debate, including legal challenges to the Affordable Care Act, reproductive rights, also immigration policies, including the public charge regulations and the future of the Deferred Action for Childhood Arrivals program. Senate Democrats can attempt to delay this process, but given the majority in the Senate, they really can't block the confirmation. So I think it's going to be a stormy couple of weeks over in the Senate as this confirmation moves forward, potentially before the election. And I think the one other area to mention, which you probably are aware of from news reports last week, before the coronavirus outbreak kind of overwhelmed Washington, President Trump did sign a short-term continuing resolution that extended funding for federal agencies and avoided a potential government shutdown when the 2020 fiscal year ended last Wednesday. In addition to providing funds for government programs through December 11th, the resolution also provided some short-term extensions for expiring Medicare and Medicaid policies and delayed scheduled cuts in Medicaid payments to disproportionate share hospitals. So very good that, obviously very good, that those policies got dealt with, at least for a short-term fix. All of them will be back on the agenda when Congress reconvenes on November 16th for that post-election lame duck session. To reset where we are, the House has approved 10 of the 12 regular appropriations bills for fiscal 2021, including the labor HHS education funding bill that is important to nursing. But the Senate still has yet to release any of its 2021 spending bills. So what lawmakers can accomplish in November and December is likely to depend a great deal on the outcome of the election. And the best way to illustrate that is if Democrats take control of the White House or the Senate, they will want to extend the current continuing funding until sometime early next year, when a new administration or a new Congress would be able to influence those spending decisions. Republicans may be more inclined to try to reach a long-term agreement, an omnibus spending plan for the rest of fiscal 2021, although without having produced its appropriations bills yet, it remains to be seen whether those would be easy negotiations or difficult ones. So I dare say that my colleagues on Capitol Hill are probably not making Christmas plans very firm at this point. We could be looking at a very bumpy session once Congress comes back after the election, and certainly a lot of issues that could affect nursing that we'll want to be keeping our eyes on. I think with that, I'll stop and see if you've got any questions for me.
Thank you, Dave, for that insightful update. You know, it's it's an interesting time. So definitely, anyone with any questions for Dave?
Hi, Dave. This is Karen Duderstadt.
Hi, Karen.
Nice to see you. And I don't know exactly if I have a question, but I think it's a comment. You know, I think my concern for us as nurse practitioners is that I had not heard the latest tweet apparently from the president about the Regeneron and the use of the polyclonal antibody. And currently here at my institution at University of California in San Francisco, we're running a phase 3 trial on that medication, and they were actually soliciting members of the public who have tested positive but did not have significant illness enough to be admitted, or certainly were short of any kind of major symptoms. And that's the population that they were actually recruiting to see if it could limit hospitalizations for those who were already positive. And I think my comment is, and all on the call know this, that it's very disruptive to the scientific process to push something out, even in a pandemic, that we don't yet know the actual risk to the larger population. And that's the risk to those running the trials, as well as those agencies and companies who develop them. So I think, as we get through this, I think the concern is, where will we be with the scientific process globally and in the nation? And how do we move forward with some kind of semblance of developing science for coronavirus or future kinds of pandemics? So I think that's a really serious piece to look at. I appreciate your continued coverage in all of these very frustrating issues. So I think we're just all hopeful of getting through this election and having some positive change.
Absolutely. No, and you raised a number of really good points. Obviously, I think there's a lot of concerns about clinical trials in general, and particularly the failure to include all of the various populations that need to be included, including children, in some of the testing before drugs come out. And that, of course, is focused primarily on the vaccine. I haven't even heard a great deal about the clinical trials with antibodies yet. So I think there are questions that I'm sure members of Congress and others will be raising there. And you also raise a really good point, which I think is a growing topic of debate, about the value of science and the recognition of evidence-based decisions, not just in healthcare, but environmental policies and a number of other areas. So I don't know where it will go. I don't know what the solution to it will be. It is probably a beneficial thing that it gets as much attention as it does. And I know there are a number of members of Congress and committees interested in oversight activities on the value of science in federal policy making. But it's going to be an ongoing point of discussion, and probably a topic for the next Congress to deal with.